We have Mr. Dominic, 72-year-old gentleman who came to us from Liberia, right, for the treatment of his prostate cancer problem. And he was, diagnosed with a heart issue when he had to undergo a spine surgery in the year 2005, when he was detected to have some cardiac issue, the details of which definitely are not with us, but there was definitely some recorded cardiac issue. And he had, after the diagnosis of prostate cancer in perhaps 2010, 2011?
2000, well, 5 years, more than 5 years.
11, say
11.
Yeah.
2011. So in 2011 we had some cardiac issues which the records are there after the diagnosis of prostate cancer. We are not very sure what was the stage of the prostate cancer at that time, but definitely it was a high risk prostate cancer because his PSA was in the range of 40 plus. So he was put on Zoladex injections, and he had been on Zoladex injection for quite some time now, for almost last 5 years, when his PSA gradually started rising and he started having problems with passage of urine. Issue of urinary tract infections and urinary obstructions, and when we detected over here, when we investigated him, he was found to have a heart issue wherein this ejection fraction, as we see on his records, was only 10%. Left ventricular ejection fraction was 10%. His PSA was 121, and the PET CT scan that we did over here, the PSMA PET CT scan showed that it was a stage 4 disease with spots in the bones as well. Since the fact that he was already on Zoladex, it fitted the definition of castration-resistant prostate cancer, and he was seen by the urology team. They had put in a urethral catheter, and he was quite okay with it. They had planned him for a urethral stent, which could not happen because we couldn't actually get one. But the question remained of the systemic treatment. Mr. Dominic, is that right?
Yes.
Of how to treat your prostate cancer?
Yeah, yes.
And the various options were hormonal therapy, second line hormonal therapy, or we do chemotherapy and things like that. So I think everybody was quite skeptical about doing chemotherapy, including his dear wife, who was quite skeptical, and we were also not very sure whether his heart can take the chemotherapy or not. And yes, with due discussions and I think with due diligence and the availability of better and safer drugs, we were able to carry out chemotherapy in this for Mr. Dominic with docetaxel, and with special formulations which are lipid-bound formulations, wherein we can give chemotherapy quite safely. And today we have Mr. Dominic after 4 cycles of chemotherapy, and I think, did you have any major trouble with?
No, I didn't have any major problem with it. And in the process, I never really had any problem. I come to the doctor and so that I'm having major problems. So during that process, I never had any major problem.
So I think this is a very important learning, that we should not turn down active therapy in patients who have low ejection fractions, or who on the face of it, based on medical records, may not be very suitable candidates for chemotherapy or any active treatment for oncological purposes. So technically it was a left ventricular ejection fraction of 10%, but after treatment with 4 cycles of chemotherapy every 2 weeks, with a 50 milligram per meter square dose as per the prostate 2 study, and with a better formulation of docetaxel, his PSA from 121 has come down to 18. I think that's a very important message which should be taken very positively. Mr. Dominic, anything else you would like to tell us about your experience of chemotherapy or not?
Well, I thought the process was a little bit demanding. I mean, you do the chemotherapy, and also the side effect was some the hair loss. Everybody knows that.
We can see your head is still full of hair.
Yes. So that I was concerned that, well, would be obvious that you have been going on that chemotherapy, by the public, or put in the heart. So, but this was not occurring. I was telling myself, we have been to the 4 cycles, right? And still, I'm still feeling a little bit, I'm feeling better, as I can say.
Yeah. So I think with this note we can say that Mr. Dominic has a heart of not 72, he has a heart of 27. It's the other way around. Mr. Dominic, thank you very much. I think you have done well. God bless you, and my best wishes. And I think with this we'll carry on your treatment,
Yes.
and you should be doing good.
Okay, thank you.
Right.
God bless you also.